Good evening, everyone, and welcome to today's session. Maggie and many more who are all online, welcome to this wonderful evening. This is the part 8 of our anatomy discussion. Good to see Mr. Khan and many more who are all present today. Once more, I want to invite all of you. Tomorrow is Sunday. Every Sunday is a precious Sunday for us because past 20 years, religiously, every Sunday we were having a full-scale grand test with a discussion and knowing what are my rights, what are my wrongs, how I can improve in my preparation, everything you can do. So starting from tomorrow 9 a.m., please download the Incus quiz app, and starting from 9 a.m. to evening 6 p.m., you have totally around every hourly 10 parts, the 300 marks full-scale grand test has been divided. So you will have the live broadcast of that, but for playing, you require to download the app, Incus quiz app, and you need to play. And after every quiz tournament is over, I will come online and we will have a discussion of those 30 questions in every quiz. So like that, we finish all 300 questions. So also inform your classmates to make the best use of the Incus quiz app. So good to see Honey, Sarah, and many more who are all online. So let's continue a quick discussion of anatomy that we had been laboring for the past 5 days. The next question, the next topic in our discussion is the penile blood supply, the penile nerve supply is the favorite area of the examiner. So the blood supply of penis. So keep punching your answers, doctor, to make this session interesting. Penis is supplied by what are the arteries and nerves? It is supplied by pudendal nerve, deep artery of penis and prostatic plexus. Pampiniform plexus is a testicular venous drainage, not that of penis. So you have helicine arteries, the dorsal artery of the penis, the common penile artery, the urethral artery, the cavernosal artery. All these arterial branches are very, very important. So the dorsal artery of penis, it mainly supplies the corpus cavernosa, which is responsible for the erection, and also the penile skin is being supplied by the dorsal artery of penis. Then the deep artery of the penis supplies the erectile tissue inside it. Then there are arteries of the bulb of the penis, supply the posterior bulbous part of the corpus spongiosum and the bulbourethral gland. And they give rise to many helicine arteries. The helicine arteries. So the arterial supply of the penis is one of the favorite area of the examiner. So this is the dorsal vein, the dorsal artery and the nerve, the corpus cavernosa of the penis, the urethra and the corpus cavernosum urethra, around the urethra. So this is how the structure of the penis cross section. So if you look at the venous drainage of the penis, some of you are going to be top urologists in the times to come. Dream big, think big, aim big, and you will get very big. So urology is a very big, urology and andrology is a very big area for the in the MCH urology. So post MS general surgery, a good number of you are aiming to be on the top of the urology. So prostratic venous plexus, it also receives the blood from the deep dorsal vein of the penis is what you need to remember. Now, how about the lymphatics of penis? So, the lymph of the penis, that is the skin of the penis, drains initially to superficial inguinal lymph node. This is very important to know because penile carcinoma is a very important entity. Once more in surgery, these things only matter. The lymph from the glands and the distal spongy urethra, they drain into deep inguinal and external iliac nodes. And the cavernous bodies and proximal spongy urethra, that drains into internal iliac group of lymph nodes. That is the story of lymphatics. Many times this question has been asked in the NEET PG exam. A very IMP topic, important topic that you need to remember. Now comes innervation of the erection and ejaculation. So there are sympathetic nerves T11 to L2, parasympathetic from S2 to S4. Parasympathetic form the pelvic plexus. So from this pelvic plexus, the cavernosal branches, they innervate the penis. Parasympathetic innervation causes erection and sympathetic activity causes ejaculation. So there is no sympathy for erection, only sympathy for ejaculation. So similarly, detumescence, that is the end of erection. Otherwise, persistently having a spasmodic erection can be one of the adverse effects of the people who take the aphrodisiac drugs, etc., etc. So there should be some end point for erection. So that's called detumescence, which is also sympathetically mediated, is what you need to remember. So the dorsal nerve of the penis, the deep perineal nerve, the superficial perineal nerve, the scrotal nerves, and the lesser sciatic foramen is a very important part from where the pudendal nerve give all these branches, is what you need to understand. So now you are very sure, doctor, erection ke liye parasympathetic, ejaculation and detumescence ke liye sympathetic. This is one of the favorite frequently asked MCQ in the tomorrow's exam. So the innervation of the penis, the nerves come from S2 to S4, and prostatic plexus of nerve innervates the parasympathetic fibers. Now comes the next important area called blood supply of stomach. The vein of Mayo is typically seen where? It is seen at pylorus. So there is a tributary of the right gastric vein. It passes anterior to the pylorus at its junction with duodenum, and that drains into the right gastroduodenal vein. And this vein, which is the tributary of the right gastric vein, draining into the right gastroduodenal vein. If you can remember yesterday anatomy, we are almost reaching the end of the anatomy. Maybe by Monday, another couple of hours we discuss, we are done with anatomy. So our entire crash course has got about 200 hours of the session. 200 hours में हर एक सब्जेक्ट को 10 घंटे में क्विकली फटाफट रिविजन करके मोस्ट इंपॉर्टेंट डेफिनेटली आस्क्ड थिंग्स ओनली आई विल डिस्कस. Otherwise, we have extensive video library. You don't have time to revise all that. So last moment revision बोले तो बहुत consolidated, condensed रहना चाहिए, right? So that is the whole purpose. Good to see Mahavir Singh and many more who are all online. Please invite your friends. And from tomorrow, please remember, every Sunday, please download the Incus quiz app, subscribe by paying a small amount of 600 rupees. You get an opportunity to solve the full-scale grand test on Sunday. 300 MCQs are divided into 10 quiz tournaments of 30 questions each. So morning 9 o'clock से शुरू होता है. अभी registration कर लो. और 9 to 10, 9 to 9:30 you play. 9:30 I will come and discuss. 10 to 10:30 another 30 questions you play. We will discuss. Like that across the day. By about 5 o'clock we discuss all 300 questions. This happens on every Sunday. So please make it a point to download the Incus quiz app and also promote it among your friends. So doctor, the pre-pyloric vein of Mayo, it is the end of the pylorus and beginning of the duodenum. That is the reason it is an important landmark whenever you are operating on the pyloric area. Short gastric artery, it is a branch of which vessel? Splenic artery. Please keep punching the answers, doctor, so that you are also engaged. So, this is the spleen, this is the splenic artery, and these are the short gastric arteries. The left gastro-omental artery. So you can see what are the branches of celiac trunk. We have already discussed that in our last class. Good to see Dr. Rupa Tejaswi in our cohort. So please don't forget, every day, Monday to Saturday, whenever I get time, I'll take 2 classes. One in the afternoon, 2 p.m., other in the night, 9 p.m. Minimum, I will take 1 hour session at 9 p.m. So totally 200 hours may I will do the revision for you, the entire 19 subjects, most high yield areas before the NEET PG exam. So they're all made available in the online mbbs.com video library. So please take every opportunity to subscribe to our online mbbs.com video library. Also, please download the Incus quiz app. And in the Incus quiz app, you have 20,000 MCQs organized as 1,000 quiz tournaments. So keep playing and it will tell you which topics you are right, which topics you are wrong, everything, and what is your performance compared to everybody else in the world. So that is a beauty part of the Incus quiz app. And I want to see Rupa to right away call 9000868 and take a subscription to the online mbbs.com video library. And tomorrow, please don't miss morning 9 a.m. every Sunday, morning 9 a.m. to evening 6 p.m. 300 MCQ full-scale grand test is divided into 10 quiz tournaments containing 30 questions each and made available in the Incus quiz app. So once you play 9 a.m. first part of the NEET PG quiz. Then 9:30, I will discuss those 30 questions live on the YouTube. That's how you are motivated across the day. So the short gastric arteries consist of 5 to 7 small branches arising from splenic artery is what you need to remember. Now, the blood supply of testis. Left testicular vein compared to right testicular vein. All of you know this. Left testicular vein drains into left renal vein, whereas right testicular vein drains into directly inferior vena cava. So that is the reason whenever left-sided varicocele is there in anybody, you should be careful and evaluate whether there is any renal mass. If there is any renal cell carcinoma, it can compress the left renal vein, prevent the drainage of the left testicular vein, and that can lead to a left varicocele is what you need to remember. So the right testicular vein drains into IVC and left testicular vein opens into left renal vein at a right angle. Now comes the blood supply of uterus. Spiral arteries, they are a direct continuation of basal artery. So this is the ovarian artery, this is the arcuate artery, then becomes radial artery, then becomes basal artery, finally becomes spinal artery, and that supplies the endometrium. Ovarian artery, arcuate artery, radial artery, basal artery becomes the spinal artery, is what you need to remember. So the spinal arteries are the ones which supply the endometrium, and myo-endometrial junction, you can in fact see on histology the presence of these spinal arteries. Now, lower limb of blood supply kaisa hota hai? So the superficial veins of the upper limb are located in which plane? They are located in the subcutaneous plane. So the main superficial veins of the upper limb are cephalic vein and basilic vein. They originate in the subcutaneous tissue, as all of you know very well. Now, when you compare to other metacarpals, how is the first metacarpal located? Typically, it is more anterior. So the first metacarpal being anterior, it is possible to take your thumb into opposition, as all of you know very well. So the medial 4 metacarpals are called parallel. They are considered to be parallel. The first metacarpal is relative to others more anterior, and medially on its axis it can rotate around 90 degrees. Pisiform bone articulates with which bone? Come on. Santosh, Subedi, Rupa, Tejasvi, Hani Sara, Mahavir Singh, and many more. Punch your answers, doctor. Very good. Rupa is betting on scaphoid. Chalo, computer Mahaday ko puchenge hum. Kaun banega PG Pati? Come on. Please punch your answers, doctor. You know, learning is more interesting when we are all betting. Right? Learning is more interesting when we are all betting. Very good. Rupa comes rightly. Triquetral. Absolutely right. She looks so pretty. Sorry. She looks too pretty. She looks too pretty. Scaphoid, lunate, trapezium, pisiform. She looks too pretty. Try to catch her is very important. Absolutely. Mahavir Singh is betting on A and also D. Good. So pisiform is the sesamoid bone. This is another favorite MCQ. Pisiform is a sesamoid bone in the tendon of which muscle? Flexor carpi ulnaris. In the dorsal surface, it presents as a smooth oval facing which articulates with the triquetral. Nutrient artery, which is supplying the bone, enters from which end? Always it enters away from the growing end. So the epiphyseal and metaphyseal artery supply is richer compared to that of the diaphysis. Diaphysis means shaft. Epiphysis growing end. Between the two, you have metaphysis. Haversian canal, where you don't see. So typically in the spongy bone. Spongy bone. So compact bone, diaphyseal bone, cortical bone, ये सब में होता है Haversian. So this is the Haversian canal, the periosteum, perforating fibers, the blood vessels, endosteum, lacuna, perforating canal, trabeculae. So this is the typical structure of a spongy bone whose unit is osteon. So Haversian system is absent in spongy and oven bones, that is cancellous or trabecular bones, whereas they are present in compact bones. The diaphysis of the long bone contain compact bone, whereas the ends of the long bone like femur, humerus, they contain spongy bone. So both the spongy and the compact bone have lamellar arrangement, whereas the oven bone does not have a lamellar arrangement. So the lamellae in this compact bone, they're all arranged concentrically around a hollow canal, which is called Haversian canal. And these longitudinal Haversian canals communicate with each other with the transverse Workman's canals, is what you have to understand. In which bone ossification center appears first? Whoever answers this question is going to be has perfectly prepared for entrance. Ossification center appears first where? Rupa is betting on greater trochanter. Let me get your answers. Rupa is betting on greater trochanter. It is the lower end of the femur. Doesn't matter, you know. एक बार wrong करे तो he was, that fact will be remembered forever. So the shaft develops at 7th intrauterine month, lower end by 9th month of fetal life, head during the first 6 months after birth, greater trochanter during the 4th year, and lesser trochanter between 12th and 14th years is what you need to remember. So doctor, all these questions I am discussing in this 200 hours crash course, they're all created as 20 MCQ quiz tournaments on the Incus quiz app. So आप खेलते खेलते खत्म करो पूरा 20,000 questions को. Every question you are playing on the Incus quiz app, you will know how others have played it, how others performed. That will create that competitive spirit. After the game is over, you go to the history. There you can get the explanatory answer for every question. And also you can add a video comment, audio comment, text comment, anything, right? So now, membranous ossification. Where do you see? Parietal bone, occipital bone, frontal bone, not in mastoid antrum. So basically, intramembranous ossification क्या होता है? The bone development is there, but it is not preceded by any cartilage. Mandible, maxilla, clavicles, and most of the flat bones on the skull, they're all formed by intramembranous ossification. Tympanic bone जो होता है, इसका एक specialty है. Squamous part of the tympanic bone is intramembranous ossification. Petrous part, mastoid, styloid process, they are all endochondral ossification. That is the fundamental difference. So in the endochondral ossification, the bone replaces a hyaline cartilage. Except the clavicles. I mean, below the skull, all bones are endochondral ossification only, except the clavicles, which are by intramembranous ossification, is what you need to remember. So the first bone to ossify in the body will be clavicle. Now, with regard to the scapula, what is the anatomical level of the root of the spine? It is at T3. Inferior angle of the spine is at T7. And the lateral angle of the scapula bears the glenoid cavity. So, if you look, the lung borders, horizontal, fissure, etc. The medial border of the scapula, typically indicates approximately the oblique fissure, not horizontal fissure. So you have a horizontal fissure, you have an oblique fissure. So the medial border of the scapula indicate oblique fissure. That's what you need to remember. So which is the cranial nerve that become decussated in the superior medullary vellum? So you should know third and fourth cranial nerves are originating from midbrain. Fifth, sixth, seventh from pons. Eighth, ninth, 10th, everything is from the medulla. So typically, if you take the trochlear, fourth cranial nerve, it is just ventral to the cerebral aqueduct. And the trochlear nerve exits from the midbrain on its dorsal surface. And the bilateral fourth nerve palsy can occur if there is any lesion in the superior medullary vellum, because that is the point of decussation. Now, which is the cranial nerve which hooks around another cranial nerve and has the longest course, intracranial course? So you should remember that a cranial nerve with dorsal exit, everything is ventral, dorsal exit is trochlear. Longest intracranial course, 75 millimeters, almost 7.5 centimeters, is trochlear nerve, which is thinnest is trochlear nerve. The one which emerges posterior to brainstem is trochlear nerve, whereas the cranial nerve with the longest extracranial course will be the vagus nerve, is what you need to remember. From the posterior 1/3 of the tongue, how is the taste sensation carried? So posterior 1/3 is glossopharyngeal. So once more, doctor, this is one of the favorite questions, IMP wala question in anatomy. VIP question, very important point. Anterior 2/3, general sensation is lingual, special sensation, taste is chorda tympani. Posterior 1/3, both general and special sensation is glossopharyngeal. And in the base of the tongue, General and special sensation is by the internal laryngeal nerve, which is a branch of the vagus. This is what you have to emphatically remember. So, base में होता है cranial root. So, the taste sensation from anterior 2/3 of the tongue is the chorda tympani, which is the branch of which is carried by facial nerve. All the tongue muscles supplied by hypoglossal nerve, except, come on, who is going to give me the correct answer for this question? All the tongue muscles supplied by hypoglossal, except. Punch your answer, doctor. Maggie is betting on palatoglossus. Palatoglossus. Absolutely. Palatoglossus is supplied by the cranial part of the accessory nerve via pharyngeal plexus. That's the only exception. So you should know superior pharyngeal constrictor, middle pharyngeal constrictor, inferior pharyngeal constrictor. This is the ribbon muscle, thyrohyoid, hyoglossus, attachment of stylohyoid. This is the genioglossus, and this is the styloglossus. So all these muscles in and around the neck, you have to have three-dimensional remembrance, doctor. So if you look at the muscles of the tongue, it has genioglossus, hyoglossus, styloglossus, palatoglossus. All these are supplied by the hypoglossal except by the palatoglossus, which is supplied by accessory nerve. And all intrinsic muscles of the tongue, lingual muscles, they're all supplied by the hypoglossal nerve, is what you have to ultimately remember. Palatine tonsil. What is the sensory supply? It is the glossopharyngeal which supplies the palatine tonsil. So, all this tonsillar area, it is innervated by the tonsillar branches of the maxillary. Maxillary is the branch of the trigeminal and the glossopharyngeal nerve. Now, quickly give me the flashcards. Smallest cranial nerve, olfactory, which enters cerebrum directly, olfactory. Largest and thickest cranial nerve, trigeminal. That is what you need to remember. So where do you see pseudo-unipolar neurons? In the dorsal root ganglia. So once more, one of the favorite questions asked by the examiner, you should know longest intraosseous course. If the examiner says intraosseous, मतलब एक बोम के गुहा के अंदर बहुत देर जो cranial जाता है वो होता है facial, because it passes through the middle ear. Longest intradural course, jura के अंदर बैठ के intradural course is abducens. Cranial nerve passing to the cavernous sinus is abducens. Cranial nerve involved in intracranial tension whenever it rises is abducens. And you should also remember thickest nerve in the body, entire body, is sciatic nerve. All of us remember when we do the dissection in the gluteal area, how thick is that sciatic nerve? A pseudo-unipolar neuron is a sensory neuron in the peripheral nervous system. And why do you call pseudo-unipolar? Because they do not have dendrites. The facial nerve, what are the terminal branches? We used to remember it as TB, tuberculosis, ZMC, Zahirabad Medical College. So, temporal, mandibular, buccal, zygomatic, cervical. Temporal, buccal, zygomatic, mandibular, cervical. So, that's the point. Temporal, zygomatic, buccal, marginal along the mandible and cervical. Stylomastoid transmits facial nerve, all of you know. Cardia tympani carries the special sensation from the anterior 2/3 of the tongue. So once more, doctor, I have discussed all these cranial nerves, everything very extensively, taking many more 40-50 questions लेके मैंने discuss किया in the onlinembbs.com video library. So please take every opportunity to subscribe to online MBBS video library. So chorda tympani carries the special sensation from the anterior 2/3 of the tongue is what you need to remember. So what is the nerve supply of platysma? It is by the facial nerve. And the chorda tympani is carried by the facial nerve. And second arch का nerve होता है facial nerve. So you should remember each of the pharyngeal arches. What are the cranial nerves? What are the muscles? ये जो table है ना doctor, IMP, very important. First is trigeminal, muscles of mastication. Second, pharyngeal arch, facial, muscles of facial expression. Third is glossopharyngeal, and it supplies stylopharyngeals. Fourth and sixth are by vagus, external laryngeal and recurrent laryngeal nerve, and they supply laryngeal and pharyngeal musculature is what you need to remember. Recurrent laryngeal nerve lies in relation to inferior thyroid artery. So अगर ये आपको दिख रहे हैं ना, ये recurrent laryngeal nerve. Inferior thyroid artery is passing like this. So recurrent laryngeal nerve, inferior thyroid artery in close relation. So that is the reason at the time of the thyroidectomy there is a great damage to damage the recurrent laryngeal nerve. You have to be very careful. Palatopharyngeus is supplied by the vagus. So the recurrent laryngeal nerve supplies all the intrinsic muscles of the larynx. What is the only exception? Cricothyroid. So that's a point you need to appreciate. Similarly, the palatopharyngeus is innervated by the cranial part of the accessory nerve via the pharyngeal plexus. That's the point. Then recurrent laryngeal nerve is also sensory and secretomotor to glottis, subglottis and trachea. That's the point. Then the external laryngeal nerve, it is smaller than the external branch. It is the smaller external branch of the superior laryngeal nerve, and it descends beneath the sternothyroid muscle and it supplies the cricothyroid. And it is this external laryngeal nerve, cricothyroid muscle, and the pitch of the voice. Some people can sing the songs, gifted with the ability to sing the songs in a very high pitch, thanks to the external laryngeal nerve, which is the branch of superior laryngeal nerve, which is basically supplying the cricothyroid. That is responsible for increasing the pitch, is what you have to remember. Alderman's nerve. It is the auricular branch of the vagus, which is called Alderman's nerve. So you should remember, Voigt's nerve is the branch of the vestibulocochlear nerve and it supplies the saccule. Then you have the Jacobson's nerve. So the Jacobson's nerve is the somatic nerve of the middle ear and the efferent branch of the glossopharyngeal nerve that goes to the parotid gland. Jacobson's nerve. Then you have the Herring's nerve. So Herring's nerve is the nerve from the carotid body to the glossopharyngeal. The connection between the carotid body and the glossopharyngeal. वो होता है Herring's nerve. So Herring's nerve, Alderman's nerve, Jacobson's nerve, ये सब चीजें favorite VIP MCQs, which you have to master. The nerve of letter jet is a branch of the vagus nerve. So whenever the people do vagotomy, what is meant by selective vagotomy? If I am only resecting the nerve of letter jet, that becomes that is the one which is supplying those acid producing glands. So without affecting the motility of the stomach, if I only want to hit those branches of the vagus which are supplying the acid producing glands, then I need to do selective vagotomy, resecting the nerve of letter jet. Kunz nerve. What is Kunz nerve? Typically, the communicating branch between the T1 and T2 nerves. It receives the gray rami from stellate ganglion and T2 ganglion. And it is very important to recognize this communicating Kunz nerve while doing the thoracic sympathectomy is what you need to remember. So, nerve of Kunz is the gray ramus running upwards from the second thoracic ganglion to the first thoracic nerve. Intrinsic laryngeal muscles, they're all supplied by the recurrent laryngeal nerve. Mandibular nerve, mandibular division of the fifth cranial nerve. It supplies all this, but not omohyoid. So mandibular nerve supplies underbelly of digastric, tensor tympani, tensor velate palatini. So both the tensors is with the mandibular nerve. So the mandibular is the largest trigeminal division and is a mixed nerve. And the motor branches of it innervate the muscles of mastication. And it is the foramen ovale from where the mandibular comes out. So what are the branches of the mandibular nerve? Typically from the main trunk of the nerve before it divides into anterior and posterior. It gives rise to a one meningeal branch. Medial pterygoid nerve, nerve to tensor tympani, nerve to tensor velini palatini, they're all by the mandibular nerve. I'm so happy to see 12 online classmates. So once more I want to tell you all, every day 9 p.m. invariably we have a class. In 200 hours, I'm going to do the revision of you, all 19 subjects. Crash course for the NEET PG 2021 from Dr. Murali Bharadwaz. Whenever I also get time in the afternoon 2 p.m., I will try to take an additional class to cover up. On the top of it, you have extensive video library on the onlinembbs.com. And also to entice you, excite you, stimulate you every minute, every moment. Download Incus quiz app from the Android store right away and then start registering for the games and play games. It only costs you 600 rupees per month, but you get a lot of practice. So now, doctor, from the anterior division, masseteric nerve, deep temporal nerve, lateral pterygoid nerve, buccal nerve, which is a sensory nerve. They're all from anterior division of mandibular nerve. Then from the posterior division of the mandibular division of the trigeminal nerve, what are the branches? Auriculotemporal, lingual, infralveolar, and the motor branch of mylohyoid and the underbelly of the digastric. The nerve which supplies the underbelly of digastric is called mylohyoid nerve, is what you need to remember. And what is the ganglion associated with mandibular nerve? It's called otic ganglion, is associated with the mandibular nerve. So in this connection, you need to know what is ans cervicalis. The hypoglossal nerve and the C1, C2, C3. They are closely related. So from the C1 comes the branch along with hypoglossal, and that goes and supplies geniohyoid, thyrohyoid, and the hypoglossal supplies the thyroid muscles, the tongue muscles. And that gives the upper root. C2, C3 से lower root मिलता है. ये दोनों मिलके ansa cervicalis बनते हैं. And from the ansa cervicalis, typically inferior belly of omohyoid, sternohyoid, sternothyroid, and superior belly of omohyoid. They're all being supplied. So this is the most crucial image you need to have in the mind. Ansa cervicalis, once more, let me tell you, doctor. IMP, very important topic, which you have to mark. So this is how the ansa cervicalis going to the infrahyoid muscles look like. And this is the hypoglossal nerve, the lingual branch of the trigeminal nerve, etc., etc. Now, the superior belly of the omohyoid, it is the superior ramus of the ansa cervicalis. Inferior belly is innervated from ansa cervicalis directly. Underbelly of digastric supplied by mylohyoid branch of the inferior ulnar nerve, which comes from the posterior division of the mandibular. And the posterior belly of the digastric, this is a favorite MCQ. It is supplied by the facial nerve. So tensor velipalatini is supplied by the mandibular division of the trigeminal nerve. So the tensor velipalatini muscle attaches to cartilage, and levator velipalatini parallels the cartilaginous part of the tube. Salpingopharyngeus attaches to the cartilaginous part of the tube and is covered by the mucosa called salpingopharyngeal fold. And this is called pterygomandibular raphe, which is the common origin of the superior pharyngeal constrictor and also for the buccinator. Both of them originate from the pterygomandibular raphe. So you need to have a physical imagination how the pharyngeal tube and how the attachments to it, pharyngotympanic tube. So doctor, with that, we will conclude today's wonderful evening. Tomorrow, don't forget, 9 a.m. to 6 p.m. 300 MCQs of full-scale grand tests are being divided into 10 parts. So 9 to 9:30, play the game. Everything 30 MCQ game. 9:30 से मैं discussion करूँगा, right? So once more, let me quickly give you an idea. www.incusquiz.com. So now the mobile app is also available in the format of the website also, Incus Quiz, but on mobile app you can enjoy more. So once you come here, click on NEET PG exam, you are having the live upcoming tournaments. NEET PG November Part 1, 8th November Part 1, Part 2, Part 3, Part 4, Part 5, Part 6, Part 7, Part 8, Part 9, Part 10. और इसका टाइम है डॉक्टर टुमारो 9 o'clock Part 1. Part 2 का टाइम होता है 10 बजे को. सो आप यहाँ रजिस्टर करना और गेम शुरू होने के एटलीस्ट 10 seconds के पहले. So just now I registered. So once I registered, it says contest is starting in so and so time. At least 10 seconds before you need to be in this page. The moment the contest begins, you start punching your answer. You can either access it through incusquiz.com or you can also access it from the mobile app. Both the things are equally good. So every Sunday we have morning to evening full-scale grand test, 300 questions in the form of 10 quiz tournaments. And every day, 2 p.m., 9 p.m., Dr. Murali Bharadwaz is there with you to hold your hand and take you in the path of winning. With all this motivation, you have to be sure to prepare, to not lose time. Another 120 days, you are going to rock it and become solid in confidence to face the competition and to become a winner. See you all tomorrow morning at 9 a.m. Good night.